family. Welcome to Midwife Reality Show.ke. I am Mary Nguru.
My name is Evelyn Gewa.
Welcome back to our channel. Today we have a fantastic topic, post-delivery complications.
Yes.
Kindly, for the new viewers, remember to subscribe, view, give us comment, and welcome to our channel.
You can also share to your friends so that you can continue supporting our channel. Yes, so today we are going to talk about post-delivery complications. As we all know that delivery can be successful, but sometimes it comes and can cause a mother to so many complications. So we are going to tackle the most common, and our first complication is excessive bleeding. Excessive vaginal bleeding after delivery can be fatal. It means that, okay, for somebody who has delivered, bleeding is expected for somebody who has delivered, because the body sheds blood and some tissue from where the placenta was implanted. But sometimes it can be termed as abnormal when the bleeding is excessive. For example, Mary, when do we say that a mother has bled excessively?
We can talk of a mother bleeding excessively after a normal delivery. If a mother loses more than 500 mils of blood, that one is counted as excessive, or any volume that will distort her observations. That is, after delivery, she may feel dizzy. The observation, that is her blood pressure, becomes low or is altered. Her pulse rate becomes high. That is how her heart beats becomes high than what is expected. So for a CS, if a mother loses more than 1 liter, that is also counted as
Excessive
bleeding. And any other that would alter her observation, that is her blood pressure, her heartbeat, and other physical vital signs. Yes.
So viewers, as you have heard, excessive bleeding can be fatal, and there are so many causes of excessive bleeding. For example, when a placenta is delivered, the place where it was implanted leaves open vessels, whereby if the uterus does not contract, or in a simple term, does not shrink to apply pressure on the embedded on the placental bed, then the uterus, the mother is expected to bleed. This is what we are meaning. Maybe you can illustrate to them what we mean by the placental bed.
Just if you're new here, this model, we use it as our uterus. This is our cervix, the purple, the pink one, and the yellow is the uterus. So normally the placenta, in normal circumstance, the placenta implants on the top of the uterus. This is the inside part of the uterus. So where you can see my hand? At this point. That is where? Yes. Now the inside part. The blood vessels come direct to the placenta, which is my hand. So once you deliver and we remove the placenta, that place is left low. So just like the art of preventing bleeding by applying pressure, the same way Mother Nature has helped the uterus to contract, that is to shrink, to put pressure on that place by contracting and thus reducing the amount of bleeding. So mine is to urge all the mothers post-delivery, allow the midwife or the doctor to explore you after delivery
of the placenta.
Yeah. Sometimes the bleeding also can come from the cervix.
Yeah.
It can tear, especially when a mother pushes before time. So you should only push the baby out whenever you are told by a care provider that you are
ready to push
your 10 centimeter.
Yeah.
And that is why we encourage
deep breathing exercise.
Yeah.
The technique of
deep breathing exercise.
Yeah.
Like where you take in
through the nose and out through the mouth.
Out through the mouth to reduce that pressure. I know it comes with that urge to push. Expel the baby, but please keep on hold. Yeah. Try to wait until you assess so that we avoid this. Yeah. Yes. Another one, we can sometimes, after removing the placenta, this model, we use it as our placenta. This is our cord. This is the placenta, the red one. And these are the membranes. Yeah. Sometimes, placenta may have what we call an extra robe. So it may be left in the utero. Yeah. Part of this.
A piece of the placenta.
A piece of the placenta may be left in the utero. Yeah. That can cause the uterus not to contract as it's supposed. Yeah. So that's making it hard for the
bleeding to be controlled.
Also some membranes, because they tear so easily. Yeah. They may be left inside. Yeah. So to me, I'm talking to that mother. I know it's very painful to be explored post-delivery, you have undergone all this. But knowing what we are preventing, please just try to remain still.
Be calm.
Cooperate. Yeah. So that we minimize and prevent the bleeding post-delivery. It's very fatal. Yeah. It's number one killer of mothers. It's never painful. Yeah. Another cause would be the bladder. Where the bladder is treated, the bladder can be full and pushes
the uterus up.
Yeah. So after delivery, it's recommended we pass urine every 2 hours. Sometimes, as a care provider, we may remove the urine from you with a catheter.
That is if you are unable to void on your own.
If you are unable to void on your own, if you are unable to pass the urine on your own. Yeah. But make it your responsibility to pass urine every 2 hours post-delivery. Yeah. Yes. Another thing that can cause bleeding is also the tears or the episiotomy that you may have gotten on the birth canal. Yeah. The injuries from the baby. Yes. All that maybe you have been given by the midwife or the doctor. So give the obstetrician time to explore, be calm, and cooperate. It means so much to your life. Yeah. Yes.
So that is bleeding.
Yeah.
Sometimes when you bleed from the uterus, it might not come out of all of it. It might cause a lot of clots to accumulate on the uterus. Yeah. And now the clots will make the uterus not to contract because they are inside and they are hindering the contraction. So just allow the midwife to remove the clots. It might be very painful. You might feel like you're in labor again, but when they are removed, then we'll sort the issue of bleeding. Our next complication is infections. Infections after the mother has delivered can come in.
Sorry, before we go to the infection, after bleeding, if we are not able to prevent the bleeding and now you're bleeding, it may lead us to anemia.
Very true.
Yeah, you get your blood pressure is low. Yeah, your heart rate is high. Like when you're seated like this, you can almost hear your heartbeat. Yeah, you get what we call palpitations. And this can lead to dizziness, and also you become prone to infections. You are more likely to have infection than a mother who didn't bleed. So kindly people, let us prevent this. Help us prevent so that we can save life.
Yeah. So talking of infection, the second topic, the second complication, as we had said, is infections, and they might come in a broad way, but here we are going to discuss about maybe the urinary tract infection and maybe the uterine infections. This is because of the way God created a woman. The urethra, that is the passage of the urine, is just adjacent to the birth canal. So maybe because of the hygiene after delivery, the way the mother is changing pads, the way the mother is maybe cleaning herself after visiting the toilet can bring the infection. And maybe lochia itself, because of staying with the pad for a long time without changing, can make us get the uterine infection. So here, hand washing is very key. Once you've done hand washing and you have cleaned yourself very well, you have changed pads properly, then infections will not be part of you. And sometimes we can even transfer infections to the baby. We were talking about this with Mary just like the other day, saying that somebody might change a pad.
Baby is crying.
Yeah.
You are from the toilet.
Yeah.
Come pick the baby. Maybe you have this fungal infection that is very common with mothers. And then come put the baby on the breast.
Yeah.
You've touched the nipple.
Yeah.
The nipple goes to the mouth of the baby.
Yeah.
The baby gets those infections on the tongue. You see the baby tongue turning whitish. The mother nipple cracks because of the fungal infection. Yeah. And all started from changing the pad. Yeah. It's like if we would have cut that infection if only you did a thorough hand wash. Yeah. So hand washing is very key. Another thing that would cause infection to the mother is the way you change your pad. Yeah. It should be front, backwards. Not backward front.
Even the way you clean yourself.
Even the way you clean yourself. Remember there is now connection because of this blood that keep trickling day in, day out. There is communication between the outside world and the uterus. So the mother should change pad regularly. Yeah. When I mean regular, let it not stay more than, whether you have a heavy flow or no heavy flow, change the pad at least after every 3 hours. Yeah. This way we'll avoid infection. Yeah. And any moment you change pad and you notice that it has a false smelling, like it has a very funny, awful smell, you should go to the hospital. Yeah. If you notice you're having chills and fevers, go to the hospital. Maybe headaches, go to the hospital. Those are signs of infection. Yeah. Some also present with difficulty in passing urine, which would mean maybe you're having urinary tract infection. Yeah. Also, cleaning your cuts. Yeah. E.g., if you had like a tear given by the baby or an episiotomy, it's always good to clean after passing stool. Yeah. And at least clean that place 3 times a day. Yeah. Nowadays there are creams people are being given. Antibiotic cream. Yeah. It has made many people to be a bit lazy. You just apply it on top. Yeah. You don't clean the area. Before you apply, kindly clean that place thoroughly. And if you notice the place is giving way, go back to the hospital. It might start with oozing first before it brings the pus. Yeah. It starts like it's removing some fluid. Yeah. Once you realize that, and then maybe pus starts forming, it's good you report it to the doctor. Yes. The next complication, remember after delivery,
You have to breastfeed, right?
Yeah.
Breastfeeding is what is recommended. So we are ready to breastfeed. But here comes a complication about breastfeeding. Okay?
Yeah.
One, I'm a first-time mother. I do not know how to hold the baby. I don't know how to latch. And I end up getting cracked nipples. That's a complication on its own because it is very painful. Very painful to have that wound on the nipple, and to latch a baby on a wound so that the baby can suckle can be very painful. Maybe there must be ways on which you can prevent cracked nipples.
Yeah, like cracked nipples, normally we say is the technique in which you're putting your breast into the baby's mouth.
Yeah, and the way you are detaching.
And the way you are detaching. So whenever you're breastfeeding, there's the nipple, the elongated part of the nipple, the breast, and the dark area surrounding that elongation.
Yeah.
You should put the whole of it in the mouth.
Yeah.
So you tickle the baby lower lip, and the baby will definitely open the mouth.
Yeah.
And you put the nipple plus the areola inside.
Yeah.
And in case you hear baby removing some sounds, like
making sounds,
that nipple is not well attached.
Yeah.
So you remove by putting a finger on the edge of the mouth and
pull the breast out.
Pull the breast out
Gently.
You
can also remove by pulling the chin down. The baby's chin down, and then pull out the breast gently to remove the baby from the breast.
Yes. Another thing, when you're still on the breast, sometimes the baby is able to suckle well, but you're producing more than the baby can handle. You get what we call engorged breasts. Baby is just removing just not so much, because at this first day, second day, they just take about 15 minutes, 10 to 15 minutes. Their stomachs are very small. So they don't empty, and the breast tends to swell.
Yeah.
And after they swell, the flow becomes low. Yeah. So by so doing, when you start feeding or getting full breast, it's always good to express the excess. Yeah. You can do by the pump or manually. Yeah. So you have no excuse. You just use warm compresses. Yeah. That is warm water with a cloth. Yeah. You massage and then you milk. Yeah. You milk it out. Then if it goes to a next, if it is not taken care from that point, you get what we call mastitis. Yeah. This is where the breast now is full, the milk now is not coming out, and you start getting pus from the veins that gives the milk. Yeah. So which is very, very bad.
It might even require surgical
intervention. So please let's avoid. Yes. From there, we have
before we go to the next one, you've talked about the pumping of the milk, the expressing. It is good to also note that in case you are pressing that milk for the baby to use, kindly sterilize what the baby is going to use. Maybe you can choose what method you would like to sterilize with, so that you don't give baby milk which has been contaminated. Yeah. The next one is the next complication is the forming of clots.
Yeah.
Forming of clots. A mother is posed to a risk of formation of clots after delivery and after a cesarean section.
Actually, with CS, the complication of the clot is higher.
Yeah. The risk is more higher than the normal delivery.
Yes.
Yes, so it is good to know what to do so that you can prevent it. And I would say early ambulation or early walking. So guys, we had talked about the formation of clots. Remember earlier we talked about formation of clots in the uterus, but this time it is formation of clots in the veins. So the formation of clots in the veins can be very dangerous because it can lead to death. Okay? Yeah, because so that's why we normally tell our clients after cesarean section, after delivery, we walk early with assistance so that blood circulation can take place or can go back to where it used to be before the surgery, and that will reduce the formation of clots. Most of the treatments that are given to our patients, depending on the doctor, are blood thinners. We make sure that you're given, although they are normally given to prevent, after the patient has come from the theater, they are normally given drugs which thin the blood so that clots do not form.
Yeah, just to add that and to what Evelyn has just said, yeah, we say walking is key.
Yeah.
Because once, like taking an example, a mother who has had a cesarean section, she'll lie in bed for a few hours. That causes stasis or delayed blood getting back to the heart.
Yeah.
That's causing that's causing the stasis that may end up causing the clot. Most of them, they will present with clots on the calf muscle, this muscle down here.
Yeah.
It starts paining.
Yeah.
It swells. So in case post delivery you find your calf, this muscle here, it's swollen.
Yeah.
It's always good to contact your care provider to rule out any clots. Yeah. Also, there are those that we call the PE.
Yeah, pulmonary embolism.
Pulmonary embolism.
Yeah.
Like when you are lying in that bed post-CS, try to do some exercise so that you don't form any clots on your lungs.
Yeah.
Yeah. Okay. So all this we can avoid by early walking.
And maybe to clarify about the pulmonary embolism, it might be so bad because it causes difficulty in breathing. You find that you can't breathe, you can't take in enough oxygen to your lungs. So it is good to prevent so that we don't get to the pulmonary embolism. Our last complication, Mary?
Well, the last complication is depression.
Yeah.
Or maternal blues.
Yeah.
These days it has become really common.
Yeah, it's very common.
It's very common. So we start with maternal blues. Is that feeling of sadness within you?
Yeah.
This mostly happens because of the depletion of hormones. The way your hormones, they were very high, now all of a sudden after delivery, the hormones have come down.
Yeah.
So most mothers experience maternal blues that occurs within 72 hours. And this maternal blues, if they are not taken care of, they may end up to...
They may lead us to depression.
To real depression.
Yeah. Which will be a topic for another day.
Yes.
Imagine if somebody has had a baby. You've gone all the process of delivery. And when the baby is here, instead of being happy, you're just sad. It is a bad feeling. So it is good to prevent the blues from leading to major depression. Yeah. So
and that is why we keep saying, let us support our mothers.
Yeah.
If you remember in our tradition, our grandmother, they really supported our mothers. Let's be there for our mothers.
Yeah.
Let you be there for your sister, for your brother, for your cousin.
Exactly.
So that you are able to pick. Remember them, they don't know whether they are suffering.
Yeah.
It's only you who can pick that this is setting in.
And it is only you who can help before we get too far. Yeah.
Thank you for watching. Thank you for keeping us posted.
Yeah.
Yes. Subscribe. Share.
Comment and leave a suggestion. This brings us to the end of the topic. See you next time. Bye.